Depending on your age or the age of your parents, you're not new to the long-term care discussion. But what comes to mind? Helping family members in their own home, perhaps having some in-home help from nursing assistants, or considering a long-term care facility. There are clearly many options depending on where we are in our aging journey. Here to help us is AARP's Marguerite Ro and Mary Mitchell with Aging and Disability Services. Thank you for being here, ladies.
Great to be here.
Yes. So, depending, I guess, on the fact we'll start here, people are living longer than they ever have, which is amazing. And we all hope to be as independent as possible and stay at home. But what are you learning about who among us is going to need that support and services? We'll start with you, Marguerite.
So the reality is that most of us are going to need some kind of support. That's about 4 out of 5 of us who will need some support at some point in our lifetime. And it really is going to depend on a person's their physical, mental, and emotional health and well-being, as well as what resources they have. In fact, I'm thinking of a dear friend of mine. She lives alone by herself, but she has limited mobility. And so she has an aide who comes in several times a week to help her with grocery shopping, household chores, and help with some of her meds, as well as hospital appointments and those kinds of things. But just to remember, it's not only the older adult, but it's oftentimes the family caregiver who's oftentimes a primary source of care who needs respite and support as well.
Definitely. And, when we hear long-term care, at least for me, because my grandma was in a nursing home, that's kind of the first thing that I think of, but there's many options, right? So what are some of those options?
Yeah, we're really lucky here in Washington State. In Washington State, we have other sources of support and facilities like assisted living facilities or adult family homes. And these places provide personal care services, meals, and sometimes medication management. But we're really fortunate here in Washington State because our emphasis has been on home and community-based services. And that's to keep us living and aging in place in the comfort of our own homes.
Yes, and speaking of that, Mary, Washington State is seen as a national leader when it comes to providing choices like we just discussed. So what are some of the services available if people want to stay in their homes and stay independent, which I feel like most people would probably want to, if I'm correct?
Yes, and thank you for that question. So the Area Agency on Aging is Aging and Disability Services is the area agency on aging for King County and Seattle. And so we are a division in the Human Services Department with the City of Seattle. And we provide support for older adults and people with disabilities and caregivers to provide that support so they can remain in their homes and the communities that they know and love. So we provide professional information and referral services, and they're free in King County through Community Living Connections. And you can access those services through communitylivingconnections.org. Services, so that is like our front door access to all the services we provide. So like case management for people that qualify for Medicaid, in-home care, or chore services, to nutrition and meal delivery, so Meals on Wheels. And those two services support nutrition and social connectivity. Also our caregiver support for unpaid family members and friends that are caring for loved ones at home. We also provide support for adult day services and Alzheimer programs, and that provides social stimulation for elders and respite care for their caregivers. And our last program I wanted to talk about is the senior activity centers that have a wealth of programs that are focused on health and well-being. So again, Community Living Connections can make the connection for you. Thank you.
Wow, Mary, that was so much good information. Both of you, Marguerite and Mary, thank you for being here to talk about such an important topic that I know so many people are dealing with right now. And AARP and BECU are here to help you plan for your future care needs. Visit them online at the website that you see right there on your screen. We've also listed the link to find Community Living Connections, and we'll have more information, of course, on our website.